Are you afraid of spiders? What about heights or clowns? What about confined spaces? These are all examples of common fears many people have. But what happens when these fears turn into something more? You may just find you have a phobia. A phobia is a common fear that 11% of people have in their lifetime. That may not seem like a lot, but that's 770 million people. 50 million people in the US alone suffer from phobias. With those kind of numbers, someone in this room probably has one. And with phobias being the most common mental illness, its numbers are on the rise. But what makes a phobia different from a fear? We all have fears, especially when we're young, like the fear of the dark or strangers. But a phobia is when the fear becomes irrational and excessive, and you never outgrow it. A common fear would be feeling nervous when on a plane and flying through turbulence, but a phobia would be not going to your best friend's destination wedding because you'd have to fly there. Or a fear would be feeling nervous when getting a shot, but a phobia would be not avoiding necessary medical treatment because you're scared of needles. And many may ask what causes this mental illness that many people suffer from. Some people say they've had it as long as they can remember, and in that case, it's hereditary. But others say that they had it from when they were little, and experts say that most likely it happened between the ages of 4 to 8 and from a traumatic experience. And it all happens from this thing in your brain called the amygdala. It stores dangerous experiences that you've had, and it remembers them. So if you keep thinking about it, it'll develop into a phobia. And there are 4 main types of phobias. Is anyone afraid of snakes? You can raise your hand. What about spiders? Or mice? This would be considered the animal type, and it's pretty self-explanatory. Is anyone afraid of heights or confined spaces? This would be considered the environmental type, and it's the things around you. Does anyone hate to go to the doctor or doesn't like to get shots? This would be considered the blood injection injury type, and this is the only type where fainting can actually occur. The last type would be considered the other type, or miscellaneous, and it's where the phobias go that don't fit into the other 3 categories, which would be fear of choking, vomiting, or loud noises. But how do you even know you have a phobia? You may feel shortness of breath, dizziness, or feel your heart pounding inside your chest when you come in contact with your phobia. But luckily there are ways that all these things can be treated. It could be treated through therapy or medication, and if they don't get treated, tend to get worse and never go away. Take 26-year-old Claire Ledger, for example. She was diagnosed with agoraphobia after spending 2 years in her house. She had to call her 70-year-old neighbors to go get groceries for her and bring supplies to her house. Every time she went out, she'd have a panic attack and feel unsafe. Luckily, she found help in a treatment, and her friend helped her climb the fear ladder and spend more and more time outdoors. Today, she works as a nurse again and has no problem leaving the house. So while we may find many phobias humorous, such as arithmophobia, fear of numbers, for the person, it can be debilitating and it can affect their everyday life. So what about you? Do you think you have a phobia?